So my next question is actually regarding critical care curriculum. So what should be the essential components of a critical care curriculum with regard to research, ensuring that our trainees are acquiring fundamental skills that are needed to study, design, data analysis, and critically appraise and ethically research practices. So how can we encourage our students to get into this more, and how can our curriculum incorporate this so that they have these fundamental skills which are required to do this research work, sir?
Yeah, Monalisa, we recently did the DRNB syllabus a few years back for this 4-year course, and we did had a research domain. Within it, the research methodology which needs to be learned by the DRNB students were all there. Even ISCCM in the FCCM syllabus and all, having a research methodology is very important. But I think the most important thing which we need to imbibe into our students and is to have an analytical mind. You see, the question has to come from the patient, and then only we can generate research. So having a good idea of research methodology, and there are in India there are a lot of workshops on research methodology. Many of the annual congresses have research methodology. In fact, there is an online, along with Dr. Anirban, we did an online research methodology in the ISCCM, which is still there in the website. So there is no dearth of access to the knowledge of different research methodology. Question is how to use this knowledge at the bedside and how to do research with this knowledge. Again, we have to give ample time to the students. Do they have that much of time apart from their duties to do research? And that is where I think this conflict starts coming. Do they probably are not getting so much of time? They just devote research into whatever is their thesis work, and that is where I think we can also imbibe some kind of having a good thesis rather than just an observational study and just collecting data. If they are given a good thesis work, for example, one of my DRNB, I have given a thesis to look at the vexus and see what is the clinical volume status versus the vexus volume status and see what is happening there. In the second one, we have given, they give a volume challenge. They look at the VTI and see the cardiac output, and also look at this at the same time what happens to the pulse oximeter saturation variation. Does that vary? Because not everybody has access all the time to VTIs and all that. So concordance of pulse oximetry, plethysmographic variation index, and VTI, what is the concordance of that on volume challenge? So those kind of practical research, I think ideas would be very important. And the research methodology has to be robust, and ethical committee, good clinical practice, that needs to be known by all the students, which are there. I think these things are in all the major hospitals, having an ethical committee, GCPs, research methodology workshops are there. But I think the guides and the students need to inculcate some practical topics on which they can work on. Over to you.
Thank you, sir. Thank you for bringing out very important points. One is actually having an analytical mind among the students is very important. And the second thing is that having protected time for research so that they don't take away time from their work to actually have a good research methodology workshop is also extremely important. Attending a good workshop, learning how to design a good thesis, and the guide can definitely help in actually designing a good thesis. Practical example, as you said, is very important. Being aware of the ethical committee of your hospital, all these are very important practical points. Thank you so much, sir.
Thank you.